Hello, everybody. Hopefully, at the end of this, in an hour and 15 minutes or so, somewhat dependent upon how many questions I get, you'll know a lot more about Medicare than you do now. So, Medicare basically has four essential parts. Part A and Part B have been around since 1965 when the program first started. Part C is Advantage plans, managed care plans, which have been around probably for around 20 years. And then the prescription drug coverage has been around now for 17, 18 years. So we're going to first talk about Part A and Part B. Then I'll talk about prescription drugs and also what are called Medicare supplement plans, and then end up with talking about Advantage plans. Original Medicare is available to anyone who's age 65 years old or older, also to folks who get disability benefits from Social Security at any age, and also folks who have end-stage renal failure to the point that they need a kidney transplant or are on dialysis. The coverage you have from original Medicare, Part A, which is hospital, only provides benefits when you're actually admitted to the hospital. So you have to be an inpatient. Pays for pretty much all the services that the hospital provides for you. Drugs they give you, nursing services, all those kind of things. You also can have skilled nursing facility coverage if you go to a skilled nursing facility from a hospital. Provides home health care in some instances if it's prescribed by a doctor. Hospice coverage is through the Part A of Medicare. Doesn't pay for doctors. So if you wake up in that hospital bed and there's 2 or 3 doctors, hopefully you're going to have other insurance because Part A is not going to pay them. There is a significant deductible if you're admitted to the hospital with Part A, but very, very few people pay a premium for the Part A coverage. The reason is pretty much everyone who's working now pays a portion of the FICA tax that goes to support the Medicare Part A program. So essentially, it's prepaid. Part B of Medicare, on the other hand, pays for services you get outside the hospital, pays for doctors who see you in and out of the hospital, has a lot of preventive benefits that it provides, pays for durable medical equipment such as wheelchairs, things like that. It pays if you're in the hospital under observation, which sometimes can be for several days. And what that means is you might go to the hospital. They might say to you, well, you really probably shouldn't go home. You have a fairly significant condition, but we're not going to admit you for whatever reason, but we'll put you in a room. Well, you can be there sometimes for 2 or 3 days, maybe even longer. You can have a substantial bill, but that's not going to be considered an inpatient service. So Part B could cover that, but you do have a 20% copay with Part B. And prescription drugs are also not covered by Part B. One huge advantage, one big advantage of original Medicare, which is a lot of times a reason why folks stay with this, is it does not have any network provisions. You can go to any provider anywhere in the United States, so long as that provider accepts Medicare as payment. Most of them do. There might be a few who don't. But it does not provide services if you're outside the United States. The cost that you're going to have with Medicare, as I said, with Part A, very, very few people would have a premium. If you don't have enough credits to receive a Social Security benefit or a relationship with someone who does, then there can be a premium, and it's pretty substantial, over $400 a month, but very few people pay that. I did mention that it had a deductible. This year it's $1,676. That covers your first 60 days that you're in the hospital. And then after that first 60 days, you can have daily copays, as it shows up there, $419 a day for the next 30 days, and then over $800 for 60 days after that. Very, very few hospital stays are going to last that long, however. If you go to a skilled nursing facility directly from a hospital where you've had a 3-day stay, the first 20 days are going to be covered by Medicare Part A. After that, you would have a daily copay, a little over $209 for the next 80 days. Now, Part B does have a premium. It's $185 is the standard premium this year. It can change from year to year. And as you'll see, there's a small subset of workers who pay or a higher premium than the $185. Folks who do not choose to enroll in Part B because maybe they feel healthy and they feel, I'm going to save that $185 premium. Well, you can, but then you are going to face restrictions later. as far as when you can enroll, and you're also going to have potentially a 10% premium upcharge that will follow you the rest of your life. There is a deductible with the Part B program. It's not real high, $257. And then you have a copay after that deductible, the copay being 20% of whatever amount that Medicare approves for that service. If you wish to apply for Medicare, you apply with the Social Security Administration. Social Security is essentially the gatekeeper to Medicare, so you don't actually apply with Medicare itself or with anyone else. However, if you're already getting a Social Security benefit or a benefit from the Railroad Retirement Board, which coordinates with Social Security prior to age 65 because you decided to take your cash benefits early, then you don't need to contact them and refile for Medicare. They know how old you are, so they're just going to go ahead and sign you up. To apply for Medicare, you can call the Social Security Administration at their 800 number, 800-772-1213. To make an appointment, you can call that number from 9 a.m. to 7 p.m. Monday through Friday. If you make an appointment but you don't get that appointment for a month or even 2 months later, it can be as many as 60 days, you're not going to lose any entitlement benefits because they treat the date you made the appointment as if that's the date you filed your claim. You can do appointments over the telephone. You can do an in-office appointment if you want to go into the office. Keep in mind, a lot of times when you go into an office, they now will sit you down in front of a computer screen and you'll be talking to somebody in another location, so you're not getting that in-person appointment that you necessarily wanted. You can also file online for Medicare only, just as you can for Social Security benefits only, at Social Security's website, ssa.gov. The application for Medicare only is pretty simple, probably takes 5, no more than 10 minutes to complete it. If you decide you're going to attempt to go into the Social Security office and just see if they'll take the application, well, you can give it a shot. However, the official policy of the Social Security Administration since the first of this year is they no longer will do just in-office walk-ins to file for benefits unless there's a dire need type situation or something like that. And that's especially true in Columbus because all the 4 Columbus offices, as well as all the major urban areas, have a lot of foot traffic. There is no premium for Part A coverage. As I said, if you have 40 credits in the Social Security system, these 40 credits are the same ones that you'd have if you're thinking of filing for Social Security benefits. There's, and folks who are dependents of someone who has 40 credits, such as a spouse, in some cases a divorced spouse, or a widow or surviving spouse, can also be eligible for Part A at no premium cost. There is no penalty ever for delaying enrollment in Part A if you don't want to take it, so long as you have enough credits, those 40 credits, that you're going to be eligible for premium-free coverage. You can apply only for Medicare Part A hospital coverage and decline Part B if you don't want to pay the premium. You are allowed to do that. You can apply for Medicare as many as 3 months before the month of your 65th birthday. If your 65th birthday is on the first day of the month, Social Security considers that you turn 65 the month before that also. And then you can also apply the 3 months after your 65th birthday. They call this the initial enrollment period. So basically your time frame for filing for Medicare, unless you have employer group health coverage, as we'll talk about in a minute, is 3 months before the month of your 65th birthday, the month of your birthday, and the 3 months after. Keep in mind, if you don't make a contact with Social Security, such as to make an appointment, before the month of your birthday, you could have a 1-month delay in your coverage beginning also. Now, if you have coverage under an employer where you're currently working or your spouse is currently working, then you are permitted to delay enrolling in Medicare Part B with any penalty or any delay in filing at a later point in time. If you're retired, keep in mind you're not employed anymore. If you have COBRA insurance, that is not considered employer health insurance, so you wouldn't want to delay signing up for Part B. And if you have marketplace coverage, or some people call it Obamacare, that's also not considered employer health coverage. It's only some place that you're working or your spouse might be working. If you have that employer health coverage, then they do allow you to decline to enroll in Part B, not pay the premium, not have any penalties later. If you don't have that employer coverage, or your spouse doesn't have that employer coverage, then you don't get that pass to not file for Part B without some penalties later. A special enrollment period is provided to everyone who has that employer health coverage and didn't sign up. That means that they can sign up at any point in the future after that initial enrollment period. Anytime that they're still covered by that group health plan or within the 8 months of the time that that group health plan would end. Your coverage would begin the month after you sign up generally, unless it's the first month that your health insurance ended. There'd be no penalties and generally no delays in coverage. If you're not covered by an employer group health plan, and if you decide, well, I'm not going to sign up for Part B, I want to save that $185, I'm pretty healthy, certainly is a choice you can make. However, once that initial enrollment period has passed, then you're only allowed to sign up for Part B in the future in the first 3 months of any subsequent calendar year, January, February, or March. Your premium would be permanently increased by 10% for every 12-month period that you had declined to have Part B coverage. So for instance, if you waited till you were 70 to sign up, you'd have to sign up in January, February, March, and your premium would be 50% higher for the rest of your life. Also, if your employer health coverage is going to end during that 7-month period around your 65th birthday, 3 months before, 3 months after, you're also not permitted to delay enrolling in Part B. You're not going to be eligible for a special enrollment period, and you'd have all those bad things happen. The general enrollment period is the period of time that you can sign up in the future, the first 3 months of the year, January, February, March. That's provided to anybody who didn't sign up for Part B, didn't have employer group health coverage, which is the reason that they'll let you not sign up for it. Also, if you have employer health coverage and you do to sign up that maybe you want to take Medicare Part B, which you can do, Medicare would be considered normally secondary payer to that insurance, which in a lot of people's mind, why would I want to pay $185 just to have something that's going to pay the deductibles with my employer insurance, which would be considered primary. Of course, there is an exception. That exception is if your employer group health coverage comes from an employer where the employer has fewer than 20 employees or more than 100 employees. If you're getting Social Security disability benefits, then the insurance companies are permitted, they don't always do this, but they are permitted to reduce the amount that they are going to pay. So if your employer has fewer than 20 employees, if you're talking about when you're age 65 or older, or more, fewer than 100, if you're getting disability benefits, you'd want to check with the insurance company to see if they reduce their coverage if you don't take Medicare. Then some folks do pay a higher premium for their Part B coverage. This is called IRMA. And basically what happens is Social Security looks at what your income was 2 years prior, and if your income goes above certain thresholds, then your Medicare premium can increase substantially from that $185 that I spoke about. The thresholds basically start at above $106,000 for a person who's filing a single tax return, $212,000 for a person who's a party to a joint tax return, and basically instead of your premium being $185, as you can see, it goes up as your income goes up to as high as $628 a month for very high income individuals. And if you are married and you live with your spouse at any point during the calendar year, but you decide that you're going to file a separate return to save on your income tax, well, keep in mind that the Part B premium may increase significantly, and it goes up much faster than in the chart right before this. For a person whose income goes above $106,000, their premium immediately goes from $185 to $591.91, which may negate, if not even exceed, the cost or the amount that they're saving in filing a separate tax return. So that's something to keep in mind and discuss with your CPA or yourself if you're thinking of filing separate tax returns and either or both you or your spouse have Medicare. Now, for folks whose income 2 years prior was maybe pretty substantial, but now they have retired or had what's called Social Security calls a life-changing event, when they file for Medicare now, Social Security will still look back 2 years, but if they've now retired and they're not working any longer, or have had any of the other reasons that it talks about up here, then you can file a short little form with the Social Security Administration, and they will reduce your premium back down to the normal level. It's called a life-changing event. There's instructions at these websites, on Social Security's websites, to find it. But basically, you could just go in and do the search engine for IRMA, income-related Medicare monthly adjustment amount. If you're not going to be eligible for a Social Security benefit where they normally just take the premium out of your check, then you can pay your premium online by creating a My Medicare account on Medicare's website. You can sign up through the Medicare website for something called Medicare Easy Pay, where they will just deduct the premium out of a bank account of your choosing. You can use your bank's online bill payment to set it up for automatic payments, or you can do it the old-fashioned way and mail a payment to Medicare itself. The only caution that I would give you is if you are not going to be having the premium taken out of your check, it's really a good idea to make sure that premium is paid, because if somebody doesn't pay their premium, Social Security will send them a couple follow-up notices for a couple of months, but after that they will suspend the payment, and they just don't let you catch up the payments and start back up again. It can be, you might have to wait an entire year to get it started, and even if not, it can be many months time you go through Social Security's process where they have to give special approval to start it back up. So I always really do caution folks, make sure your premium is going to get paid. If you've been waiting to sign up for Medicare because now you want to have dental benefits, vision, and so forth, if you have original Medicare, unfortunately, original Medicare does not provide routine services in the nature of dental, vision, and hearing. All the things that is listed up there. It will pay for dental procedures that are medical in nature or vision services, but it doesn't pay for eyeglasses, eye exams, yearly cleanings or semi-annual cleanings, so forth. Medicare has lots of preventive benefits, screening tests, vaccines. You have an annual exam provided with Medicare. A Welcome to Medicare exam pays for testing supplies related to diabetes also. Anybody in here getting any benefits through the Veterans system, the VA system? The VA system and Medicare do not coordinate their coverage. So basically, if you know somebody that has VA coverage, they can go there, but Medicare is not going to help pay for their services there, nor vice versa. Anyone in here have a health savings account? If you have insurance where you have a health savings account, so generally you have a high deductible plan, the thing you have to keep in mind is that if you elect to sign up for Medicare, even Medicare Part A, the IRS no longer permits you to make tax deductible contributions to your HSA nor your employer. If you elect to do that, there's a tax penalty that you would pay with them, plus you'd lose, you'd have to pay taxes on that money. So it does behoove you to do your research to see if it makes sense for you to sign up for Medicare then or wait till later. And the other thing to keep in mind is that if you elect to wait, whenever you're eligible for Medicare Part A, whenever you do finally file, maybe you don't file till the next year or 2 years later, Social Security will generally make your Part A coverage retroactive as many as 6 months from the date that you filed, not to go earlier than age 65. There is a publication with the IRS, it's IRS Publication 969, which goes into more detail about how it works. Here in Ohio, all of the state retirement systems for state, county, local government employees generally have coverage, health coverage for their folks. All of them require that their members, when they retire, sign up for Medicare, at least Medicare Part B, possibly Medicare Part A and Part B, because it's a lot less expensive for them to have you get your expenses paid by Medicare as opposed to their health systems paying that. The Ohio Public Employees Retirement System will reimburse folks who are not insured for premium-free Part A. You must apply with them to do that, and all of them generally are going to require that you sign up for Part B and very possibly reimburse you that premium. So that's good to check with your system, whether it's STRS, SERS, PERS, police and fire, whatever, to see what your obligations are as far as Medicare and their health coverage when you retire. Next, I'm going to talk about insurance that will help pay Medicare Part A's and B's deductible, but does anybody have any questions at this point about anything I've covered? Yes.
Once you hit your IRMA, and let's say you want a life-changing event, like you can't appeal that otherwise. That just stays with you. You understand what I mean?
It's not going to stay with you the rest of your life. It's just for the calendar year. Every year, Social Security does a data exchange with the IRS. They see what your income was 2 years prior. And if your income goes above those threshold levels 2 years prior, then your premium is increased for that calendar year. At the end of that year, then they do the same thing for the 2 years prior. And as far as, can you just say, well, I don't think I should pay it? No, unless it's one of those life-changing events, your Medicare premium is going to be increased. The decision to charge you more money is made each year based upon your income from 2 years before. But things like big withdrawals from a tax-deferred account, that can trigger IRMA. Capital gain can trigger IRMA. A lot of normal things that people do can trigger IRMA, yes. Sure.
So it doesn't go any lower than the 180.
Only if you're eligible for government assistance, and we'll talk about that later. Yes, sir.
You turn 65 in March, sign up in January, right?
3 months before.
So does it have to start in January?
No, it starts when you're 65.
That doesn't start to the first one. And so as far as the HSA,
Mm-hmm.
we do contributions for...
You can do prorated contributions for the months before your Part A starts.
prorated.
Yes. Which we'll talk about in the publication that I talked about. Yeah. Yes. Yep. Yes. It's a deductible. Not if you go within 60 days. Yeah, so like if you went in January and then you were there, let's say you're there a few days and you went back in April, you're going to pay it again, yes. Yep.
But also with the skilled nursing care, you were in there for 19 days and you leave for 3 days and you go back in again. Is that considered the same?
I actually don't know. I've never been asked that. Check with me or after.
Okay.
But generally, you have to go to the skilled nursing facility. You have to go from the hospital, and your stay has to be 3 days. If you're only there 1 day, you don't get the 20 days. If you're there 2 days, you have to have a 3-day stay from the hospital.
Okay.
Yes, ma'am. Mm-hmm. As I said, if you make a large withdrawal from a tax-deferred account, that can trigger IRMA 2 years down the road. If you make a large withdrawal, regardless of what you do with it, it then becomes taxable, it's on your tax return, and you'll have IRMA 2 years later. It doesn't matter what you do with the money you withdraw. Once it's withdrawn, it goes on your tax return, it increases your income, and you'll pay IRMA. Yep. Okay. Now, some folks like to keep original Medicare, but they might not want to pay those co-pays and those deductibles. So they might have group health insurance from a place that they used to work or a union that they used to work for that would pay those for them in whole or in part. Then some folks might have limited income and they might qualify for government assistance to pay those co-pays and those deductibles. But for people who don't have those two options, then they can purchase from private insurance companies supplemental insurance, which will pay in whole or in part, depending on the policy, the co-pays and the deductibles that you have with Medicare Part A and Part B. Your primary insurer will still be Medicare. So Medicare will still be the folks who decide what they're going to pay and if they're going to pay. But the private insurance companies, once Medicare has approved the charge or the procedure, then they would pay the co-pays that you'd have with A and Part B. These plans are called Medigap or Medicare Supplement, but basically what they are is you're purchasing private insurance, so you're going to pay a premium for it, just like you do for house insurance, car insurance. You have to have both parts of Medicare Part A and Part B. Depending upon which policy you elect to get, you will have limited your out-of-pocket cost other than the premium. It's going to pay in whole or in part your co-pays and your deductibles. You're still going to be able to go to any provider you want to go to. None of these Medicare supplement plans generally have networks for doctors or hospitals, but they also do not pay for drug coverage. So you can still use any hospital or provider that accepts Medicare, unless you get what's called a Medicare Select plan, where you might have a lower premium, but you might be limited in the hospitals you go to. But these do not have annual enrollment periods. So basically you sign up for one of these when you're first eligible for Medicare and Part A and Part B. They don't provide any additional medical coverage that you have with A and B, but they can make your cost if you go in the hospital, go to a doctor, have a procedure, much, much less, little or no out of pocket. These plans, there's 8 standardized models. They're identified by a letter, A, B, and so forth. The A and B have nothing to do, they don't have any special relationship with Medicare A and B. They're just called A and B also. But the one thing is, there's 8 different plan models. Every plan that is sold by whatever company you're purchasing it from of the same letter is exactly the same thing. Exactly the same coverage, with one big exception, what you pay for it. Last time I looked, I think there's 50 different plans out there provided by probably 20, 30 or more insurance companies. But the premiums that you pay for those plans, the least expensive one for someone turning age 65 is around, say, $115 a month. The most expensive one is more like $260 a month. And folks say to me, well, what's the difference? I said, this is what you pay. Well, why did they do that? Because they can. So it does pay to do your research. It probably does pay not to just take the first company that you talk to and say, oh, they must all be the same, because they're not all the same. Their coverage is all the same, but their premium is not all the same. Now, if you want to get a Medicare supplement plan, if you like the idea of being able to go wherever you want to go for service, plus have coverage without, if you're traveling or such, without having to deal with networks, you'd want to look at the plan, decide how rich of a plan that makes you comfortable. You'd want to compare those plans on price and how quickly the premiums increase with age, because if you purchase one of these, generally the premiums may be adjusted by the company every year in the month of your birthday. Some plans don't do the adjustment, some do, and some do fairly significant adjustments. OSHIP up there means the Ohio Department of Insurance, their Medicare section, and our agency here. We can provide you, if you ask us, with pricing schedules from a database that the Department of Insurance obtains, which can give you the price listing from least expensive to most expensive for all of the plans within a certain letter. So for instance, if you were to call me up or Andy up and say, hey, I'm thinking about buying a plan G, can you give me some information? We can send you a database that has all of the companies listed from least expensive to most expensive, tells you how quickly their premiums would increase for the first 5 years you have the plan, and so forth. And so can the Department of Insurance. You would sign up for these plans with the insurance company, not with the Social Security Administration, not with Medicare. This slide basically is just a screenshot from Medicare's website that tells you the 8 different plans or the plans that are available and what they cover, what the difference in the coverage from the different plans is. But you can go to medicare.gov and look at this very same thing. This is a page that I snuck out of a Medicare supplement plan a few years back, so the prices aren't there, but I just basically put it in here because all of these plans, as I said, the premium generally is going to increase as you get older. The company that was selling this particular plan, as you can see, at that point in time, if somebody 65 had bought a plan G, their premium would have started here, but 10 years later, it would have risen to $176. Every company is different. All of them wouldn't increase that much, and I have no idea what this particular policy costs now. But if you purchase one of these plans from an insurance company, it should have information like this in there so you can see how quickly the premium increases if it does increase. Yes, sir?
So are those future year prices, that's based on locked in?
Yes. When you buy one of these plans, you're locked into their schedule. Yes. These aren't guaranteed for the rest of your life either. If the claims experience of the insurance company is such that they feel that they need more premium, they can petition the Department of Insurance. They can say, hey, we had this schedule, but our claims experience has been more. We're not going to have enough money to pay claims. So yes, this could go up in the future. Well, it's like every other insurance. I buy house insurance or car insurance, and it's not guaranteed for the rest of my life. So, yeah.
All of those are individual plans with individual prices.
All of those, yes. Yes. You know how many insurance companies there are. They might all be selling these plans. They might all have different pricing structures, every single one of them. The only thing that you can for sure count on is if you decided I want a plan G or a plan A, you could contact 10 companies, 20 companies. The coverage for those plans is going to be exactly the same. What you pay for it may vary significantly. Well, you'd only have one plan. You're not going to have more than one plan. No. Plan A and Plan B is Medicare. You get that through the government. These are you're mixing up. Don't think it's Plan C and Plan D. That's another animal. We're going to talk about that in a minute. Okay. I wasn't just talking about it. I said there are 8 different Medicare supplement plans, A, B, C, D. You're not going to buy more than one of these. I talked initially about Plan C and Plan D, but this has nothing to do with that. Yes. Yep. They didn't ask me. There's a few things that the government has that they didn't ask me what should they call them. But in any of that. Now, when should you buy one of these? You should buy one of these during what they call the guaranteed issue period. Because if you buy it during that period of time, it means the insurance companies can't ask you any questions about your health, your weight, or anything else. They have to sell you the plan. The guaranteed issue period is a 6-month period. It starts with the first month that you're age 65 or older and also have both Medicare's Part A and Part B. So if you're 66 and you turn 65, we'll say, and you're going to have Medicare A and Part B, for the next 6 months, you can buy any of those plans. They can't ask you any medical questions. They can't ask you anything about your health or anything else. They have to sell you the plan at their standard rate. Once that period of time is over, that guaranteed issue period is over, then if you decided you want one of these plans, you could still purchase them. But the insurance companies are then permitted to ask you for health information, health history. They're permitted to ask you what's your weight and so forth, and they're permitted to deny you coverage or authorize you coverage, but maybe charge you a higher rate than their standard rate. So the time to buy one of these is during the guaranteed issue period. Sometimes folks may lose their coverage from someplace else because their insurance company goes out of business or something. Then they get a much shorter guaranteed issue period, like 63 days, to purchase a supplement plan. Also, somebody might have had a Medicare supplement plan for an extended period of time. Maybe they're thinking, oh, maybe it's getting too expensive for me, or I'm just tired of paying that monthly premium. If they go to a Medicare Advantage plan, which they can only do during the open enrollment period, but if they do, they can switch back within the first year after they get out of the supplement coverage. They have to go back to the same company, but they are permitted to go back to have a supplement plan. And sometimes the premium will even decrease even significantly just because of the way the insurance industry works. But that's something to keep in mind. Otherwise, if you purchase a Medicare supplement plan, you don't get an open enrollment period every year, at least in this state. There's 2 or 3 states where you do, but where you can switch companies or anything. You can always apply with any company for coverage, but the companies are not required to write a policy for you. So if you're interested in Medicare supplement coverage, you would want to look at the various types of coverage plans that are out there, decide which one sounds best to you. Not everybody needs something that's going to pay all of their copays and deductibles in full. Maybe 75% is good for them, 50%, whatever. It does make some sense to look at 2 or 3 different companies, look at the initial premium, look at how quickly that premium is going to increase, at least in the first 5 years, especially if you get that chart from us. Be thinking about, can you afford it now? Can you afford it later? And you're not stuck with it for the rest of your life. If you want information about supplement insurance, you can go to Medicare's website. Just put Medicare supplement insurance in the search box or go to that long little URL there. But then there's lots of information on Medicare's website that talks about the supplement insurance plans. I'm going to talk about prescription drug coverage next. Is there any 1 or 2 questions about supplement before I go? Okay. Yes.
So the supplement
Medigap, MedSup are the same thing.
and it is not
And it's not the same as an Advantage plan. After we talk about prescription drugs, we're going to finish up with Advantage plans. Okay? Okay, prescription drug coverage has been around now for 17, 18 years. Even though this is a government benefit provided by Medicare, it's offered by private insurance companies under contract with Medicare, with the government. There's 2 ways that they offer this coverage. One would be a standalone prescription drug plan. All it does is give you drug coverage. And then the other way would be to get a Medicare Advantage plan where they roll the drug coverage in with the medical coverage. Just as with Part B, you could have penalties and restricted enrollment periods if you turn age 65 and you decide not to enroll in a prescription drug plan or an Advantage plan with that coverage, because maybe you don't take any drugs. And I've spoken to people who say, I didn't take it because I don't take any drugs, so I just decided I don't want to have it. And you can do that, but if you do that, then you, as you'll see in a minute, you're going to have restricted times that you can sign up for it in the future, and your premium will also increase. This year, there were 14 plans that covered and provided only prescription drug coverage here in Central Ohio. There were 66 Advantage plans that had prescription drug coverage on the other hand. These plans cover drugs from pharmacies that you go and fill a prescription, not the drugs that are given to you when you're in the hospital, nor drugs that you go to a doctor's office to have administered. The one exception where you would not have to have prescription drug coverage is if you have what's called creditable coverage from another source that pays your prescription drug coverage. That's actually a legal term, not something I just thought sounded good. So if you were to call your insurance company, if you had an insurance company that provides drug coverage, you would want to ask them, is the coverage I get from you, is it considered to be creditable coverage? And very simply what that means is that whatever drug coverage you have, whether it's from a union, an employer, or anybody else, is it as good or better than Medicare's? If it's as good or better than Medicare's, then Medicare doesn't say you have to buy a Medicare prescription drug plan. If it's not considered to be creditable coverage, and then you choose not to sign up for Medicare's drug plan, you can have penalties and enrollment delays later. When you turn age 65, the time that you would sign up for a Medicare prescription drug plan is the same 7-month initial enrollment period as we saw early in the presentation when we were talking about Part B. If you declined enrollment at age 65 because you had creditable drug coverage, you can enroll in Medicare's drug program at any point in time. You don't have to wait till the general enrollment period or anything like that. If your creditable coverage ends for some reason, maybe you were working someplace and you stop working or the company goes out of business, then you're given a shorter 62-day period when you can enroll without penalty. It can also be some other special circumstances, but those are probably the most prevalent. Anybody who has Medicare Part A or Medicare Part B or both can get Medicare's prescription drug coverage. If you want it, you can enroll with the insurance company itself. You can also enroll in Medicare's drug program through Medicare's Medicare.gov. If you want to talk to somebody or need assistance, we can help you here. The Ohio Department of Insurance representatives can also help you. If you want to change from one drug plan to another, you can do so every year during what's called the open enrollment period, October 15th through December the 7th. If you hadn't previously enrolled and now you decide you want to have drug coverage, that's also the period of time that folks who declined to enroll when they were 65 can then enroll, and your coverage would start on January 1st. There is a strong encouragement to anyone who has Medicare drug coverage that every year during that period of time that you either review your coverage yourself at Medicare.gov or talk to us or talk to the Department of Insurance. The reason is the companies can and do sometimes change their formularies, change their pricing for drugs and so forth from year to year. If you want information about the drug costs you're going to have, again, you can go to Medicare's website, just put in Part D cost, and it'll tell you how that can differ from company to company. You might have heard of Tier 1, Tier 2, Tier 3. I'm not going to go into a lot of details. That's just ways that the companies differentiate in what they charge for the drugs. The premium cost that you would have for a standalone prescription drug plan this year, there's one plan that has a 0 premium. So really, even if you don't take any drugs, there's no reason not to at least take that coverage. No, that's just anybody, $0. The most expensive plan would be $124. The deductibles can range from $0 to $590. Your copays can vary from plan to plan. However, this year there was a catastrophic limit placed on the drug plans where the most you're going to pay for drugs would be $2,000, but that is for covered drugs. If you're taking a drug that is not covered by the plan you chose, then that catastrophic limit would not necessarily apply. And the thing you have to also consider is every plan, that is put out by the insurance companies, they may have different formularies. They don't all cover all the drugs. They don't all cover the same drugs, nor do they charge the same price for the same drugs. One plan might charge $10 for this drug, another might charge 50, 100, or 1,000. They also do not have the same pharmacy networks. Different pharmacies give you better pricing with different companies and so forth. So it does pay to do your homework. And just as with the Part B program, higher income folks may pay more for their drug coverage than lower income folks. Same income breakpoints, but what happens there is they start, if you're above $106,000 if you're filing an individual return or a joint return, they add $1,370 to your whatever the standard premium is, and on down the line. If you file separately, same thing. You go immediately from no surcharge to $78.60. So if you're buying a Medicare or considering a Medicare prescription drug plan, the things you would want to consider would be the cost of the plan and the cost of the drugs, the coverage, and the convenience. As I said, every plan has different pricing structures, different formularies. None of the plans all have cover the same drugs. If you pick a plan that doesn't have a drug that you take, they, at the minimum, before they would provide coverage, might require you to try other drugs that maybe you don't necessarily want to try before they would say, we're even going to cover that. You could take two pharmacies on different corners. Your cost at this pharmacy might be $500, $1,000 more than the pharmacy across the street. And I cannot stress, any cost you have is going to be based upon your own individual drug cost. So if you have a friend, a neighbor, a spouse who says, you need to get my plan because it's the best thing going. It might be the best thing going for them, but it might be the worst thing going for you. So you'd want to review your drug plans every year with us here at COAAA, or with the Department of Insurance, their Medicare section, OSHIP, or by calling Medicare at 1-800-MEDICARE, or going to Medicare.gov and using their comparison tool. And and keep in mind that if you're thinking about not taking any drug coverage and you don't have creditable drug coverage, the premium increase that you would be facing down the line is a 1% premium increase for every month that you delayed enrolling in a Medicare prescription drug plan. So again, if you waited till you were 70 years old, your premium would increase by 60%. Yeah, 60%. 1% for every month that you did not have the coverage. Yes, sir. They cover drugs. They cover drugs. Yeah, but basically the drug plans just pay for drugs. Mm-hmm. Yes, ma'am.
So from on Medicare A and B, I go to the Medicare website. Are they giving me a list?
We're going to talk about how you compare these plans really towards the end of it. And if I don't, I think it's going to answer your question. If not, then ask it again, okay? But yes, there's tools on Medicare's website that can help you do the comparison that have all the companies listed. Yeah. Now, Medicare Advantage plans. These basically are the Part C of Medicare. Might call them combined A and B. If you're approaching age 65, you probably have enough postcards and such you could paper a wall in your house with them. Anybody who has both Part A and Part B of Medicare can enroll in a Medicare Advantage plan. These plans do differ from one service area to another. Here in Ohio, for instance, the plans that are offered in Central Ohio, Columbus, and maybe the counties that touch Franklin County would differ possibly from the ones in Cleveland, Cincinnati, Dayton, and so on and so forth. None of these plans have any age restrictions. None of these plans have any medical restrictions. You will never be asked for any medical information by the company selling you the plan because they're not allowed to ask you that. They have to sell anybody who has Medicare A and B the coverage. So they don't care if you have any pre-existing medical conditions. Basically, what happens if you purchase an Advantage plan, you'll still have in your pocket the Part A and Part B of original Medicare, but your coverage will be provided by the insurance company that you're purchasing that Advantage plan from. You'll still pay your Part B premium, and the government will give it to the insurance companies. There's two types of these plans. One is called HMOs, Health Maintenance Organization, with such really just a short word meaning the coverage offered by that company, that plan, I should say, you have a definite network of providers that you have to go to for coverage. PPO plans have a preferred network where you get the best pricing, but if you decide you want to go out of coverage or out of network because you just want to try someplace else, they'll help pay for those, but you're going to pay a higher percentage or a higher cost for that coverage. Almost all of these plans roll the prescription drug benefit into the coverage. There's only, I think this year there's only 2 or 3 that did not. So you also have to look at the drug coverage they provide to see if that's what you want. The characteristic of these plans is that they will have lots of copays and lots of deductibles for most of their services. A lot of the plans will have little or no copay, maybe to go to your primary care physician, maybe a few other things. But generally, lots of medical services, you're going to pay so much for an x-ray, so much for an MRI, a deductible if you go into the hospital, and so on and so forth. Also, the networks and providers are going to vary from plan to plan. Here in Columbus, for instance, we have 3 major hospital systems. You got the Mount Carmel system, you have the Ohio Health system, and you have the university system. Some plans you have to go to an Ohio Health system. Some plans you can go to Ohio Health or University. Some plans you can go to Mount Carmel and University also. There's no plan where you just go to University, but that's something you might want to consider. The doctors that are in those networks, if you pick a plan where your doctor is not in their network, you can still go to that doctor, but that insurance company is not going to help you pay the expense. The time you would enroll in a Medicare Advantage plan, again, we go back to that 7-month initial enrollment period. Or you can enroll in a plan if you never enrolled in one before and you didn't have employer health coverage during the open enrollment period. Or if you've been in an Advantage plan and you decide you don't like that plan anymore, then you can switch to a different plan every year from October 15th to December the 7th. You can also switch to another plan if you already have Advantage coverage each year from January in the months of January, February, and March. So how do these plans work? You'll get your coverage from the insurance company's Advantage coverage, not from original Medicare. Your charges, if you have any, would be submitted to that insurance company, to that plan, not to Medicare. Hold on to your red, white, and blue card, because you still that's still your insurance in your back pocket, but you wouldn't provide that to a doctor or other provider if you went to them. Keep in mind that you might have to deal with mandatory or preferred medical networks. Keep in mind that if you go out of network, the plan might not pay anything, or they would pay a lesser amount. A lot of these plans, I think around 19 of them this year, had no premium at all. How can they do that? They can do that because they get a very nice stipend check from the government every single month to cover the plan's costs for just taking responsibility for the medical costs for all of their enrollees. And they have really smart people who work in their actuarial departments who can figure out how much money they need to charge in addition. And they will tailor these plans to different, subsets of the population. Some people might want things that are very robust and then have large networks that go all over. Maybe they have higher premiums, maybe they don't. But it's like everything else. They tailor these to market to different people, what different people like. Some of these plans might require that you get a referral to go see a specialist. Some of these plans will have most of these plans today will have coverage for vision, dental, and other routine services that are not covered in original Medicare. Some plans have more robust coverage. Some plans will offer you more robust dental or vision coverage for an additional amount of money also. As I said, there's copays and deductibles for just about all of their services. Some of these plans might offer you a rebate or a cash card or other incentives to try to get you to encourage you to join their plans. These plans do not coordinate with Medicare supplement plans. So if you purchase one of those Medicare supplement plans that we talked about earlier, you would not also purchase a Medicare Advantage plan. So if you're going to choose a Medicare Advantage plan, we always tell people first, especially if you take drugs, look at their prescription drug coverage, because that's a cost you know you're going to have. Next, look at the medical providers in the plan. I always tell everybody, call any medical provider that you absolutely wish to keep and ask them what Medicare plans that they will accept for payment. Because if you pick the wrong one, you might not be going there anymore. Can you use out-of-network medical providers? That's important to some people, not so important to other people. What's your extra cost? Especially if you have an HMO type plan and you're going to travel a lot, you might be in a lot of areas where there are no network providers, and then you could have significant cost if you have to get medical services. Some people, it's important. Does the plan offer benefits that you don't get from original Medicare? Not just vision and dental, but maybe silver sneakers, maybe an over-the-counter drug benefit, maybe a premium rebate. There's at least a couple plans that give significant rebates of your Medicare premium. What's the extra cost? What's the plan's catastrophic out-of-pocket limit? And basically what that means is if you have significant medical costs in a year, the plans will have a point at which you don't have to pay anything anymore. I think the least expensive or the lowest catastrophic limit I've seen for any plans is around $3,500, $3,600. I've seen other plans where your catastrophic limit can be as high as $12,000. So to some folks, that's something you might want to look at also. Those extra benefits, those can be things like a card that you can take to the grocery or the pharmacy that's going to help you pay for things. It could be the vision and the dental services. It could be extra costs to help pay for hearing aids or a hearing exam. It could be transportation that they might provide to go to and from doctors to some level. It could be an over-the-counter drug benefit. Go to the pharmacy, it's going to pay so much. It could be a meal benefit when you're released from the hospital. Or it could be silver sneakers, which basically is a gym membership. All these things are great. I like getting free things just as much as the next person. The only caution that I give anybody is when you're getting these plans, you really want to key in on what your medical costs are going to be. That's where your big expense is going to be if you go into the hospital. And that can be way higher than that $100 Visa card that you get every 3 months. Now, if you have a supplement plan and you want to go to a Medicare Advantage plan, you can do that every year during the time that the open enrollment period is. If you have one supplement plan and you want to check out another company's supplement plan, you can do that anytime. You can always apply with the insurance companies. It's up to them if they want to give you coverage. On the other hand, if you have kind of maybe a bad health history or other factors that companies look at, you might have difficulty in switching to another plan. If you want to go from one Advantage plan to another, anytime during the open enrollment period or the first 3 months of the year. If you want to go from an Advantage plan to a supplement, you can always apply with the company providing the supplement, but you can only drop that Advantage plan during the open enrollment period. So the three things you'd want to look at if you're thinking of a supplement plan or an Advantage plan, first would be the cost, because you got to pay that every month. Provider, you obviously have greater latitude in choosing different medical providers with a supplement plan and with an Advantage plan. And then your personal circumstances. If you're going to be traveling a lot, you might want a supplement plan at least during that period of time, because if you're out in rural Arkansas, rural California, rural wherever, there might not be any providers, network providers that are there. You already use a lot of health services. Folks who already know that they're going to be spending, going to the doctor, hospitals every month and get big bills. The amount that they pay for premium for the supplement might not be that much more, if any more, than what they're already going to pay what they would pay with an Advantage plan. Some folks, they want to be able to go to wherever doctor they want to go to. That's something to consider. On the other hand, if you basically you're just going to be here in Columbus, Ohio, you're not going to be traveling very much, you might be happy with an Advantage plan and all the other things that are listed up there. I'm going to talk now about comparing these plans, but any general questions about Advantage plans before I go further?
Explain the reimbursement for
There's at least, this year there were at least 2 Advantage plans that if somebody signed up for them, they would reimburse the person like $160 a month of their $185 premium.
And is that what you talked about with like the Visa card?
No. No. There's other plans that they'll send you a Visa card you can use at one of the drug chains or the supermarkets, but there's all different ways they do it.
But it's still coming out.
It's still coming out of your Social Security check no matter what.
But your premium could be higher than cost what you pay.
Yeah, you could pay us over $600 if you make over $500,000 a year.
Which could be more than what that monthly grocery card or.
Oh, absolutely. Yeah, absolutely. Your Medicare premium is going to come out of your Social Security check no matter what, unless you have low income and are eligible for one of the programs I'm going to talk about in a minute. Yes, ma'am.
So you said that you can't be disqualified for any health issues from the supplement, right?
During the guaranteed issue period, yes.
So if you go to an Advantage plan, can they qualify you?
Never.
Is there any, I was going to say, very quick,
You can be the sickest person in the United States and still get an Advantage plan.
can't get too sick, right?
During the enrollment,
Well, you can only enroll at certain times, but yes.
they can't ask you any questions.
That's Advantage plans have to take you. If it's a period of time you can enroll, they've got to take you.
I'm with the one Advantage.
I'm sorry?
I am with one of the
Advantage plans?
plans,
Yes.
and I use the benefit
Mm-hmm.
go to the acupuncture. That's the list of the LAC acupuncture.
Hold that question till we're done and speak to that lady standing right back there. Okay?
Okay, thank you.
Thank you. Okay. Now, if you're thinking of buying a prescription drug plan or a Medicare Advantage plan, and you want to do your research or your comparison, you can go to Medicare's website. You'll see this guy, or every so often they change the picture, but basically there's tools on Medicare's website that will help you do your research and your comparison as opposed to talking to an insurance agent. Not that I have anything against insurance agent, because I do not, but basically they have information on every single plan because they basically oversee these companies. So if you select the coverage where it says find plans now, you're going to see this gentleman here. You're going to put in your zip code. You're going to put in the type of coverage that you're looking for. And then it's going to take you to a series of pages where you'll put in information about yourself. And then it will list the plans from least expensive to most expensive based upon your drug coverage, and also allow you to compare the coverage you get from those plans. At the top of the web page, on the home page, you're going to see the words that are up there. If you click on basics, all of these little topics are going to be available to you. The cost from different plans, the cost for Medicare, your rights, reporting fraud and abuse, a link to any form or publication that Medicare has, all the Medicare handbook if you don't have yours. All of that's going to be available to you right there on the website. If you click on health and drug plans, then you're going to get this submenu where you can start a search of Medicare Advantage plans. If you want information about supplement plans, you click on that link over there and on down the line. Providers and services. If you're looking for a certain provider for a certain service, there's a tool on here It will help you to find them. If you're looking for durable medical equipment, things like wheelchairs and stuff, there is, if you click on that link, it's going to tell you places you could go to get that coverage. It's also going to tell you what Medicare covers. Some folks could also be eligible for financial assistance in paying their Medicare premiums and copays. There's 4 different levels of that. Basically, there's programs called Medicare savings programs. These programs can pay your Medicare A and B coinsurance and also your deductibles and maybe even your premium. Depends upon the amount of income that you have. Any single person with income $1,791 or less, married couple $2,400 or less could be potentially eligible for this coverage. Sometimes certain types of income can be ignored, so if you're even close, it pays to go ahead and see if you're eligible. There's limits on resources, just shy of $10,000 for a single person, a little over $14,000 for a married couple. To apply for this type of assistance, you would apply or get information through the Ohio Medicaid hotline or Franklin County. You can call that number there. I believe it's only before 12 p.m. though. You can do it online. I'm told the online application is not the most consumer friendly in the world, but there's a number of ways that you can get information or apply for that. Social Security has assistance for folks with their drug coverage where you might not have to pay any premium or a reduced premium, minimal copays for your drugs and so forth. The income limits for this assistance significantly higher than in the last screen, as is the resource levels. You would apply for this coverage with the Social Security Administration online. They make it really easy. You don't submit any documentation, no bank statements, no nothing. They basically do a data exchange with the IRS and a couple other agencies, and they determine if your income and resources meet the program's criteria.
I don't know if that's net or gross.
Well, they exclude certain kinds of things, so yeah, and it would be your gross income, but they have exclusions. Their motto is, if you're even close, go ahead and apply for it, because it literally takes about 15 minutes to do it. It's pretty simple. If you want assistance in the future, you can call us here, Andy or I. One of us is generally here every day. That's our number, or you can, and there's information on our website, COAAA.org. We're the number at the top. That's right. You can call the Ohio Department of Insurance, the OSHIP with the P folks, as they like to call it. They answer their number from 8 to 5, 7:30 to 5, Monday through Friday. You can call Medicare.gov. They answer their number 24 hours a day, 7 days a week, except for a couple days during the year. If you have a question about filing for Medicare, you can call the Social Security Administration at their toll-free number. But if you have a question about what Medicare covers, or drug plans or Advantage plans, these are the last folks you want to call because they only are the gatekeeper to the Medicare program. Okay? If you have Medicare and then you're experiencing some problems, maybe you're in the hospital and they want to discharge you and you don't think you're ready to go home, or you have just an issue with them or a complaint, Medicare contracts with an agency to help people with problems like that. That agency is called Levanta. I've included their contact information up there. You can appeal the discharge, and if you do, basically they will stop the discharge until such time as they have had a chance to review the medical file, or if you just have a general complaint. If somebody knocks on your door and wants to sell you a Medicare plan, close the door. That's not permitted, or all of the other things up here. And there's an organization called Pro Seniors can help you with that issue. And then this cartoon here, I kind of included in here. You might recognize those folks there, a former president and Speaker of the House. I basically put it in here because, once again, we're in a time where you have a lot of folks in public life who are questioning, is Medicare or Social Security going to be around 5 years, 6 years, 7 years from now? 1 out of 5 persons who live in the United States has Medicare. 1 out of 6 of them get a Social Security payment. I think it's really pretty likely that either of those programs are going to be permitted to go belly up by the federal government. So just as when this cartoon, which is over 40 years old, they have a Medicare careening down the hill, going off the cliff, and they have Social Security hanging there. The programs may very well change. They probably will change at some point. But if you hear somebody say they're just going to go bankrupt, take it with a grain of salt, no matter which party they're in or anything else, because there's too many Americans who rely on that coverage. So I hope you found this interesting. Thank you. I'll be around. My colleagues will also be around.